A Look at Health is underwritten with a generous support of Ellis Medicine, reinventing healthcare one patient at a time.
Welcome back. Well, this week in A Look at Health, we're going to have part 2 of my in-depth interview with cardiologist Dr. Andalib Nawab at Ellis Medicine. Women can get screened, correct? You mentioned this earlier in the interview, and I just want to cycle back to it. What are the screening, what is it like?
There are a lot of screening tools out there. We knew about Framingham risk scores, and I'm just throwing out these names for the viewers just so that they kind of know that these screening tools are there.
Yes.
There's a Reynolds risk score, but just very recently there is a risk score called ASCVD risk score. You can actually get that on your iPhones. It's an easy tool you can download for free on your iTunes or Apple Store. And basically what it tells you, it gives you a risk score that would estimate of you getting a risk of heart disease at 10 years and what is your lifetime risk. And it's based on certain risk factors. There are certain risk factors that none of us can change. We can't change our age. We are going to go older. We can't change where we are born or what family we are born, so we can't change our genetics. But there are so many risk factors that you can control, and that's your blood pressure, your cholesterol, your diabetes, your lack of exercise, your tendency towards gaining weight, to get a good diet. A lot of those, and the most of all is smoking risk. So you can change your age, gender, family history, but you can change a lot of risk factors that will affect your future risk of getting heart disease.
Doctor, I've got one last question. So much of medicine today revolves around preventive medicine.
Absolutely, you're right.
Much better and much more efficient way to find out and prevent yourself from getting sick by understanding certain things when you go to the doctor. And it would seem to me that with women, and I'm not trying to generalize here, but women know everybody's birthday.
Yes.
They know the day they got married. You know, the classic thing with us is we never remember our anniversary. But there are numbers that a woman should be aware of concerning her health when she goes to the doctor. And without getting into the details of what those numbers should be and whatever, what are the specific categories that a woman should concentrate on when she goes to the doctor?
I want women that next time they go to their doctors, remember 4 numbers. Always ask your doctor, what is my blood pressure? What are my cholesterol numbers? And 2 numbers within the cholesterol profile that they need to remember is their total cholesterol and what is their good cholesterol, which is an HDL.
Right.
And then the third is what is my blood sugar number, because that's very important, because that means are you somebody who are at risk for developing diabetes? A diabetic is more prone to develop those plaques and that first heart attack. And the fourth one is your BMI. That's your weight according to your height and waist circumference, because if you are over the limit or you're obese, your risk of having plaques or having that heart disease is very, very high on the list. So those 4 numbers, I want all women to ask their doctors every time they go to the doctor.
Well, doctor, it's really nice talking to you. Not only are you very knowledgeable, but you're very passionate about it too, and it really comes through. You're so quick to smile, you know. Hey, I want to cycle back on this. When these numbers thing, blood pressure, cholesterol, good and bad, cholesterol, your blood sugar, diabetes, have that check, and your BMI, which is your weight to height ratio, and probably a lot more involved than I just said that. But that would give you a real indication of whether or not you're at risk, and if you are at risk, to give the doctor the opportunity to focus in more clearly on what they need to do to make certain that you don't run the risk of heart disease, right?
Perfect.
Well, Dr. Andalib Nawab, thank you very much for coming in and talking to us.
Thank you for letting me do that.
You're quite welcome. To see this interview again, you can head to our website, looktvonline.com.